Immunization. It is a way of protecting the baby against possible attack by germs through the use of vaccines. It provides protection to baby from several dangerous diseases that can cause death like tuberculosis, polio, measles, mumps, rubella, diphtheria, pertussis, tetanus, and hepatitis. So the materials or equipments to be used is vaccine syringes 2 ml and 1 ml, tuberculin syringe with 26 and 37 gauge needle, cotton balls with alcohol, dry cotton balls, and container for sharp needles. To administer BCG vaccine. Special consideration. BCG vaccine comes as a dry powder. Before you can use it, you must reconstitute it with diluents. Reminder that BCG immunization, before you use any vaccine or diluent, check whether the label is still attached to the vial. If it is not, dispose the vial, whether it is the right vaccine or diluent. Whether the expiry date of the vaccine or diluent has passed, it has, and dispose the vial. Whether the vaccine vial monitor, if one is present on the vial, has changed color. If it has, dispose the vial. Reconstituting the freeze-dried BCG vaccine. Always keep the diluent cold by sustaining with BCG vaccine ampoules in refrigerator or vaccine carrier. Using 5 ml syringe fitted with a long needle. Aspirate 2 ml of saline solution from the open ampoule of diluent. Do not use the omega syringe and needle for reconstituting vaccine. Inject the 2 ml saline into the ampoule of freeze-dried BCG. Thoroughly mix the diluent and vaccine by drawing the mixture back into the syringe and expel it slowly into the ampoule several times. Return the requisite vaccine on the slit of the foam provided in the vaccine carrier. For the procedure, first, we have to check and review immunization record or baby's record book. We assess client's ability to take vaccine, check the potency and expiry date of the vaccine, read the manufacturer's instruction, and identify the client. Of course, we have to wash hands, prepare the materials needed. We explain the procedure to the parent. Position the child. BCG vaccine is usually injected on the outer part of the left upper arm. Inject the vaccine in the same place for each child to make it easy to find the BCG scar subsequently. Ask the parent to free the child's arm from its clothing, to see the child on her or his lap, and to hold the child firmly. We inject the BCG vaccine. The dose of BCG vaccine is only 0.05 ml. Load the syringe with BCG vaccine. Do not shake the BCG vaccine ampoule. Shaking can damage the vaccine. We cleanse injection site with cotton ball soaked with alcohol. We hold the child's arm with your left hand so that your left hand is your underarm. Your thumb and fingers reach around the arm and stretch the skin tight. We hold the syringe in your right hand with the bevel of the needle facing up towards you. Lay the syringe and needle almost flat along the child's arm. We insert the tip of the needle just under the skin. Insert only the bevel and a little bit more. Keep the needle flat along the arm so that it goes into the top layer of the skin only. Keep the bevels facing up. Do not push too far and do not point down or the needle will go under the skin. If BCG is injected under the skin, an absence of enlarged glands may result. To hold the needle in position, put your left thumb on the lower end of the syringe near the needle, but do not touch the needle. Hold the plunger end of the syringe between the index and middle fingers of your right hand. Press the plunger in with your right thumb. Inject the vaccine and remove the needle. If you have injected the BCG correctly, you will see a clear flat top swelling on the skin, like a mosquito bite. Swollen skin may look pale with small pits. When an intradermal injection is given correctly, the plunger is hard to push. If the vaccine goes in easily, you may be injecting too deeply. In this event, proceed as follows. To stop injecting, immediately correct the position of the needle and give the remainder of the dose, but no more. If the whole dose has already gone under the skin, not repeat the dose. Ask the parent to return with the child if any side effects such as abscesses or enlarged glands appear. After that, we discard the needle in the sharp object container without recapping. Reposition the client, wash hands, reassess and evaluate the comfort and reaction of the client after the procedure. We observe for any adverse effect. For documentation, we record and chart the injected vaccine on the immunization record or baby's record book. And then we record, document your observation and the reaction of the client towards the procedure. And we affix signature. Oral polio vaccine. For the procedure, we check and review immunization record or baby's record book. We assess client's ability to take vaccine, check the potency and expiry date of the vaccine, read manufacturer's instruction, and identify the client. Of course, we wash hands, prepare the materials needed, and explain the procedure to the parent. We open the OPV container oral polio vaccine as it comes in either a plastic dropper, bottle, or a glass vial with a dropper in a separate plastic bag. And to open a dropper bottle, remove the cap and put the bottle on foam in a vaccine carrier to keep it cold. We remove the metal cap, remove the rubber stopper, cut open the plastic bag containing the dropper, and fit the dropper on the open vial. Put the dropper and vial on foam in a vaccine carrier to keep them cold. We position the child. Ask the parent to hold the child firmly with the child lying on her or his back. Give the OPV. Open the child's mouth by squeezing the cheeks gently between your fingers. This makes the child's lips point outward. Hold the dropper over the child's mouth at an angle of 45 degrees. Let 2 drops of vaccine fall from the dropper to the child's tongue. Note the dosage may differ depending on the brand of vaccine. If the child spits the vaccine out, give another dose. And then we reposition the client, wash hands, make an appointment for the next schedule of immunization, and we reassess and evaluate the comfort and reaction of the client after the procedure. We observe any adverse effect. Record and chart the vaccine given on the immunization record or baby's record book. Record, document your observation and reaction of the client towards the procedure, and then we affix signature. The points to remember, we give 2 drops on 3 occasions at 6 weeks, 10 weeks, and 14 weeks. Oral polio vaccine is the most sensitive of the EPI vaccines. We keep it on ice and check the vaccine vial number before use. Listerine DPT vaccine. For the procedure, we check and review immunization record or baby's record book. We assess client ability to take vaccine, check the potency and expiry date of the vaccine, read the manufacturer's instruction, and we identify the client. We wash hands, prepare the materials needed. We explain the procedure to the parent, prepare the DPT vaccine, shake the vial so that the sediment at the bottom mixes completely with the liquid. If the toxide is not well mixed, then correct dose cannot be given. If you suspect that the toxide has been frozen and thawed, check for damage by using the shake test. Remove the center of the metal cap on the vial with a metal file. We position the child. Ask the parent to remove any clothing from the child's right or left leg so that the thigh is bare. The child should sit on the parent's lap as indicated below. The parent's left arm should be around the child, supporting his head and holding the outside arm. The child's inside arm should be tucked around the parent's body. The parent's right hand should hold the child's legs firmly. We cleanse injection site with cotton balls soaked with alcohol. And then we inject DPT vaccine into the thigh, never into the buttocks. Put your finger and thumb on the outer part of the middle of the child's thigh. We stretch the skin flat between your finger and thumb. Quickly push the needle straight down through the skin between your fingers and go deep into the muscle. Press the plunger with your thumb to inject the vaccine. We withdraw the needle and press the site with cotton ball. We discard needle on the sharp object container without recapping. Reposition the client, wash hands, make an appointment for the next schedule of immunization, reassess and evaluate the comfort and reaction of the client. After the procedure, observe any of the adverse effect. For the documentation, we record and chart the injected vaccine on the immunization record or baby's record book, and record documentary observation and reaction of the client towards procedure, and we affix signature. Points to remember, the combination of diphtheria, pertussis, tetanus, DPT vaccine is usually given at the same time as the OPV. Give 0.5 ml on 3 occasions at 6 weeks at 10 and 14. Inject TPT to the child's thigh. Do not inject TPT into the buttocks. Buttocks should not be used as immunization site for children or women because there is a risk of injury to the sciatic nerve which can cause paralysis, and do not freeze TPT. Booster hepatitis B vaccine. We have to do the same procedure for the assessment and planning. For the implementation, we also have to explain the procedure to the parent. And then we prepare hepatitis B vaccine. Shake the vials with the sediment at the bottom mixes completely with the liquid. If the toxide is not well mixed, the correct dose cannot be given. If you suspect that the toxide has been frozen in fructose, check for damage by using the shake test. Remove the center of the metal cap on the vial with the metal file. Position the child when hepatitis B vaccine is given at the same time as TPT vaccine. It should be injected into the leg, not used for TPT vaccine. Health workers usually inject TPT vaccine into the left thigh and hepatitis B vaccine into the right thigh. Ask the parent to remove any clothing from the child's leg so that to uncover her or his thigh. The child should sit on the parent's laps indicated below. The parent's right arm should be around the child supporting her or his head. The parent's left hand should hold the child's legs firmly, and when cleans the injection site, cotton ball soaked with alcohol. Inject hepatitis B vaccine, you'll need a sterile 0.5 ml syringe and a sterile 25 ml 23 gauge single-use needle. Wet your finger and thumb on the outer part of the middle of the child's leg. Stretch the skin flat between your finger and thumb. Quickly push the needle straight down through the skin between your fingers, and when you go deep into the muscle, press the plunger with your thumb to inject vaccine. Withdraw the needle and press the site with cotton ball. Discard needle in the sharp object container without recapping. Position the client. Wash hands, make an appointment for the next schedule, and we assess, evaluate the comfort and reaction of the patient. We observe any adverse effect, and to document, record, and chart the injected vaccine, the immunization record, or the baby's record book. To record, document your observation and the reaction of the client, and affix signature. Administering measles vaccine. Special consideration: measles vaccines come as a dry powder. Before you can use it, you must reconstitute it with diluents. Using a 10 ml syringe filled with long needle, spread 5 ml of special diluent from the ampoule. Empty the diluent from the syringe into the vial with the vaccine. Parallel mix the diluent and vaccine by doing the mixture back into the syringe and expelling it slowly into the vial several times. Do not shake the vial. Protect the reconstituted vaccine in the slit of the foam provided in the vaccine carrier. Check and review immunization record, a baby's record. Assess client's ability to check vaccine. Check the potency and expiry date of vaccine. Read the manufacturer's instruction. We identify client and assess adequacy of client's adipose tissue by selecting appropriate injection site. We wash hands. Prepare the materials needed. For the implementation, we explain the procedure to the parent. Position the child. Clothing should be removed by the child's left upper arm so that the measles vaccine can be injected in there. If injection is to be made into the child's left arm, he or she should sit on the patient's lap as follows. The patient's left arm should be around the child, supporting her or his head and holding the left shoulder. The child's right arm should be tucked around the parent's body. The parent's right arm should hold the child's legs out of the way, and parent's right hand should hold the child's left hand. Cleanse injection site with cotton balls soaked with alcohol. Inject measles vaccines. You need a sterile 0.5 ml syringe and a sterile 25 ml 23 gauge single-use needle. Hold the child's arm from under you. Your fingers reach around the pinch of the skin. Push the needle into the pinch of skin. The needle should go in a sloping angle, not straight down. Do not push the needle too far. Control the needle. Support the end of the syringe with your thumb and finger while you push the needle in. Do not touch the needle itself. Press the plunger with your thumb to inject the vaccine. Withdraw the needle and press the side with the cotton ball. Discard needle and sharp object container without recapping. Reposition the client. Wash hands. Reassess and evaluate the comfort and reaction of the client after the procedure. Observe for any adverse effect. Record and chart injected vaccine and immunization record or rabies record. Record document observations and reaction of the client toward the procedure. Reaffix signatures. Administering tetanus toxoid vaccine. We assess clients by reviewing home-based maternal record or HBMR. Assess clients' ability to take vaccine. Check the potency and expiry date of the vaccine. Read the manufacturer's instruction to identify the client. Wash hands. Prepare the materials needed. Explain the procedure to the client. Prepare tetanus toxoid. Shake the vial so that the sediment at the bottom mixes completely with the liquid. If the toxoid is not well mixed, the correct dose cannot be given. If you suspect that the toxoid has been frozen and thawed, check for damage by using the shake test. Remove the center of the metal cap on the vial with a metal file. Cleanse injection site with cotton ball soaked with alcohol. Inject tetanus toxoid. You need a sterile of 0.5 ml syringe and a sterile 25 ml 23 gauge single-use needle. The syringe and needle are of the same sizes as those used for giving DPT and hepatitis B vaccines to the children. Ask the woman whether she prefers her immunization to be in her left or right arm. Put your finger and thumb on the outer part of the woman's upper arm. Use your left hand to squeeze up muscle of the arm. Quickly push the needle straight down through the skin between your fingers. Go deep into the muscle. Press the plunger with your thumb to inject toxoid. Withdraw the needle and press with the cotton ball. Discard needle in the sharp object container without recapping. Reposition the client. Wash hands. Make an appointment for the next scheduled immunization. Assess and evaluate the comfort and reaction of the client after the procedure. Observe for any adverse effect. For documentation, will record and chart the injected vaccine on the HBMR. Record document the observation and the reaction of the client towards the procedure. Affix signature. Points to remember: tetanus toxoid is given to women of childbearing age, or in some countries to pregnant women only. Give 0.5 ml on 5 occasions. TT1 as soon as the woman reaches childbearing age or as early in pregnancy as possible. TT2 at least 4 weeks after TT1.